Welcome to our Wellness Wednesday Health Show. I'm your host, Dr. Kala Hewlett from the Back Pain and Joint Center of Texas. And today we have a little more serious topic as August is Overdose Awareness Month. And every year in this country, over 90,000 Americans die from overdose. And one of the really sad things that we've learned is over 70,000 of those deaths are from opioids specifically. So we have a special guest today. We're with fellow Lion, Judge Wayne Mack, who in his courthouse will often see the end result of some of these addictions. So Judge Mack, thanks for making some time today, as I know you're a busy man.
Thank you, and I appreciate your willingness to raise awareness about this, because there's a lot of people that don't realize the opiate addiction that's happening, and the fact that people are dying from this. And like you said, 71,000 deaths, the CDC reports, from this crisis. And what we're seeing is that it's not getting better, it's getting worse. And COVID has actually propelled people's addiction, propensity for addiction, and the things. And the other side of this is, the illegal part of this, where people are buying drugs that they believe are safe and they're not, and they're laced with fentanyl, and we're seeing all kinds of deaths. And not only do we, one of my duties as the justice of the peace, as you know, is in our county, is I'm also the coroner. And just this last weekend that I was on call, we had what we believe to be 3 deaths related to drug overdoses. And
so this is something that we just don't see on the news. This impacts our community here.
It does, and it impacts it in such a way, in generational ways, because when you have somebody that is battling that addiction, it affects their family, it affects their employment, it affects their social circle. But when it ends in death, the guilt and the shame and all the things that go with that are just really terrible. In that we've got to put light on this subject, and it's just like suicide and behavioral health and all the things. And what we do know is a lot of people that are struggling with addiction, the component of this is the mental health issues that people are struggling with, that they have. They're trying to self-medicate. And so the fact that we don't have access to proper mental health, and in Texas, even when it comes to addiction, our biggest mental health and drug treatment facilities are our county jails.
Yeah, and it's, I always say, nobody wakes up or they're in elementary school and says, hey, when I grow up, I want to be an addict.
Yeah.
Or hey, I want to have a divorce and have my kids never talk to me and sleep under a bridge because I can't hold a job because I'm addicted. But that's the end result that we see of this.
Yes, and it speaks to where we're at as a society, because a lot of people that struggle with these addictions, a huge majority of those folks have some type of trauma in their life. And as a result of that trauma, they have a brain health issue. And as a result of that brain health issue, now they're trying to self-medicate versus treatment and getting the proper things that they need to do. And we've got to take responsibility for this as a community.
There is. That's why I'm glad you're making time for this today, because what we've become, I call it the Walmart generation, where so many times I'll meet with someone and I see more pain in my clinic, but so we're like, no, I don't have any pain problems, and we see the prescriptions you're taking. Well, where are you taking all these? Oh, well, it doesn't hurt. As long as I'm taking these.
Yeah.
And usually it's some pretty strong medication they're taking several times a day.
Yeah.
But we've come a generation, or it's just a society, where we think a pill fixes it, and so we neglect to get the real treatment that's going to fix us, or that we actually need.
Yeah.
But I think we've hit that tipping point where people are now realizing, saying, hey, the medication has its place, but it's the overuse, the misuse, the abuse that needs to stop.
Well, I think Western medicine as a whole, we treat the symptom, we don't treat the disease. Instead of, having a healthy living style and eating and exercising regularly, well, let's take blood pressure medicine. We're sad, so let's take an antidepressant because we're sad. And it's, like you said, and medicine has its place. Don't take what I'm saying
100%,
to say,
yes.
I was almost killed by a drunk driver back in 2001, and without the pain meds I would have had a hard time recovering from that. But At the same time, if that would have led to an addiction, and a lot of times, as you know, in your medical profession, it's something that happens that causes that, and then it gets out of control, because rather than getting, the proper pain management, and and I was fortunate that I had a doctor, my orthopedic doctor, when I was dealing with all my terrible soft ligament joint joint ligament pain. I was hit right there at 75 and the loop, and rolled 3 times in the McDonald's parking lot. So I had terrible pain. And my orthopedic doctor actually said, I think chiropractic would be a great option for you. And it changed my life, because I was able to then get the healing versus and treat the disease and not the symptoms.
The pain medication used responsibly allowed you to get through the day.
Exactly.
You're getting the treatments to fix it. And that's really the marriage where the responsible use of these, but again, so often, unfortunately, that doesn't happen. For someone that may be watching this and they may have an addiction, a drug addiction they're dealing with, what would you say to them?
So the first thing to do is to acknowledge that you have that issue, and then get professional help, because you're not alone. You're not the only person that's battling this, and there are professionals that can help you manage that, and getting with your medical professionals as well as somebody that can help you overcome the addiction. And there's a spiritual component to this, there's a mental component to this, there's a physical component to this. And these all things, you talked about the marriage of these things. For you to overcome addiction, you have to understand you have hope, and you have to understand you're not alone. And there are people and there are programs to help you. But the first step is saying, I need help.
And thank you for sharing that. What we're going to be doing throughout this month, so you guys make sure you stay connected with us. Next week, we're going to be at a local inpatient rehab facility that helps people detox and get off of those, because if it's been a while, sometimes it's a 30, 60-day inpatient treatment facility. So we'll be at one of those locations. We're also going to be talking to some local support groups with addicts, and then we're also going to be doing a chronic pain workshop of alternatives to opioids to help someone get off of chronic pain in a safe way. So I love what you've shared there. Now, second question, if someone is watching this and they're not addicted, but maybe it's a family member, a friend, or a coworker, and they see that they're addicted, what would you say to them?
So that's a really difficult role to be in, because you care about this person and you want it to change. Unfortunately, with any type of drug addiction, alcoholism, and so forth, that person has to recognize. So strongly encourage the person that sees that need, that there's resources out there for families that are have family members that are addicts. Al-Anon when it comes to alcohol, and NAMI is a great resource here locally when it comes to those type of addictions, and getting the support you need to understand what you can and can't do, because there are things that you don't want to do that are just going to increase the angst of that, and there are step-by-step things that you can do, and being able to support that person that's battling that addiction. But it's more of what not to do versus what to do, because holding that person accountable. We know that a lot of folks that battle with addiction, they struggle with truth and reality, and you have to protect yourself, because as somebody that's living that lived experience with somebody, you have to protect yourself from their bad decisions. And I couldn't tell you how many times I've done PC at the jail back when I was doing that, and somebody is in the car with somebody, and that person is making the bad decisions. Well, they're in the car with them, they get stopped as a result of a law enforcement action, they both end up going to jail. And they got those scenarios. But there are things that somebody that is struggling with that, and they're watching that loved one, they're watching that friend, there are things to do to direct them, and those resources we talked about would be great places to get that information and knowing what to do and what not to do.
I love what you said a few moments ago about hope, that you're not alone, there's hope.
Yep.
And in 2021, we have resources, right? These are things that we can talk about now. And So thank you tremendously for the amount of time you've given us today.
You're welcome.
Any other last thoughts you'd like to share with?
So, yes, so whether you're battling addiction or you know somebody that is, you may feel alone, but you're not alone. You got a community that cares about you. There's resources here, but most of all, God cares about you, and you're not alone. And so that first step is acknowledging that you need help, and recognizing there is hope. And with that, hope is the most powerful thing in the world.
Thank you, Judge Mack.
Thank you.
Guys, mark your calendar again. Stay with us throughout this month because we're going to be bringing you lots of different information as we acknowledge and bring awareness to the International Overdose Awareness Month. Also, save the date for August 28th from 8 a.m. to 10 a.m. We're going to be having an overdose awareness walkathon at the parking lot of the TransMed Center. So again, save the date. We have lots of things coming to help shed light, to bring awareness, and to educate you on this topic. Thanks again.
Thank you, Doctor.
See y'all next week.
Thank you.